Hi, my name is Donald Wiper, and I'm the chairman of the department at Greenville Hospital System, OBGYN. And what I'm going to talk to you today about is really geared towards medical students or those considering a career in OBGYN. And what I am going to tell you is why it is a great time to consider graduate medical education in obstetrics and gynecology. There are a number of things that have happened over the last 10, 20, 30 years that have continued to prove and affirm that our field of women's health is a terrific one, and the lifestyle for a practitioner in our field has only gotten better and better, and it's always been a compelling thing to do, but now it's even better than it ever has been. I want to start by describing a little bit about what we do in women's health, for those of you that don't know. Everyone starts with 4 years in med school, and that's followed by a big decision about what GME training to go into. And of course the typical ones are internal medicine, pediatrics, general surgery, OBGYN, urology, neurology. There are many, family practice. OBGYN is what we're here to talk about, and OBGYN is a 4-year commitment, and what happens after residency is usually about 95% of people go into general OBGYN practice, and about 5% or so do a fellowship. And there are only 4 board-approved fellowships, and they are in GYN oncology, or cancer for women. They are in MFM, which is high-risk obstetrics. They are REI, which is reproductive endocrinology and infertility, and the last one is urogynecology, which is disorders of the pelvic floor, incontinence, pelvic floor reconstruction. So these 4 are the ones that you can get into after residency. These all are additional 3 years, with the exception of GYN oncology. There's a growing trend for some of those to be 4 years. So it's another 3 or 4 years of training after 4 years of medical school and 4 years of residency. So it's a big commitment, but our board of OBGYN is committed to the highest level of training, and it takes time. So with respect to what one does after that training, the real magic of OBGYN is that when you decide to go into it, there's an incredible amount of opportunity. So there's lots of variety, and there's lots of continuity of care, and there's something for everybody. So what do I mean by that? Well, if you go into pediatrics, you're going to take care of people from birth till about age 18, 19, maybe 21. If you go into adult medicine, it's mostly people in the 4th, 5th, 6th, 7th decades of life, because younger adults typically don't have many medical problems, so they don't seek a lot of care. In OB, you're dealing with kids all the way to the elderly, and as you can see by the fellowships that we have, you can pursue all kinds of things, including endocrine studies. You can do high-end radiology by being a maternal fetal medicine specialist and also being an expert in maternal fetal physiology. You can be a cancer physician and do cancer surgery and administer chemotherapy. You can get into genetics. There's just a huge amount of variety within women's health, because our scope and our commitment to women is lifelong. And the other thing that that comes with this lifelong commitment to women and their health is we tend to become someone's physician, and that lasts no matter what their medical problems are. There are some great things that have happened in our specialty in the last decade or so that has really made the field even more and more attractive. I will say it's always been compelling forever. OBGYN's been a desirable residency. It's always been compelling, and I think that's true because the story of taking care of mothers and infants and delivering babies and the continuity of care we provide has always been hugely appealing to medical students. And so OBGYN has never had trouble filling its residencies. But what we have seen over the last decade or two is that the quality of the candidates has just gone through the roof. And I think there are a few reasons, a few macro level reasons why things have continued to improve in our favor. One thing is duty hours. And duty hours are the restrictions placed on those that are in training. Our residents typically now work about 60 to 70 hours a week, sometimes less, sometimes more. The max by national rule is 80. There was a time when duty hours didn't exist, and OBGYN was a very feared residency. And at that time, pre-duty hours, people were working in the 100+ hour range per week, sometimes up to 120. And the residency was difficult, and I think there were people that really would have loved women's health but chose not to because they didn't want to go through this, which was a very rational thing to do. The second thing that's happened is not only have duty hours during residency are under more control, but your life as an attending is much more sane than it used to be. And so what's happened here is that there's been a shift from people being in practice individually into groups, or from being in private business to more of an employed model. And what this has done, people being in larger groups and being employed by larger systems, is it has improved the quality of life for the attending. So instead of being in practice by yourself, you're in a group with 5, 6, 7 people, and you might take call once a week. You might take call 2, 3, 4 times a month. And that is a very doable, sane lifestyle where our attendings in OBGYN really aren't working any harder than our friends that traditionally have been in the so-called lifestyle professions like pathology or radiology. So it's very sustainable. So we have not only improvement in the training, but life afterwards has gotten a lot better. And I think that that's made for a much more desirable field for people to go into. Those two changes have been coupled with changes in patient expectation. And remember, our patients are women, and they have made it okay for us to work in larger groups, meaning the patients aren't expecting the doctor to be there for every delivery and everything. They understand that physicians need boundaries and need a work-life balance. And so the patients have come right along with us as far as making it okay to work in larger groups, and they know that you can't be there all the time. Mind you that in the beginning of modern obstetrics, back in the 40s, 50s, and 60s, most people were in solo practice, and patient expectations were that you were going to be there for everything, and that's just not the case anymore. The last big thing is malpractice. And although malpractice issues exist, OBGYN is really about 7th or 8th on the list of most frequently sued, which isn't very much. And furthermore, some of the very high malpractice insurance premiums and claims have really become largely a thing of the past. And so people aren't really avoiding OBGYN anymore because of this. And so that's really helped us. The other thing is, as people have gotten into employed situations and in larger groups, employers, hospitals, tend to be self-insured or take care of this, so the individual practitioner isn't worried about having to pay big bills for malpractice anymore. And that has helped us quite a bit as well. So when you combine those macroscopic forces along with our compelling story of being women's health providers, so we've always had a compelling story. We've had some favorable macro changes. What it's meant is OBGYN is still and always a great thing to do. I hope this quick introduction and a few thoughts about women's health is helpful, and I hope if you get a chance to explore women's health, you'll be able to see it as I see it, and appreciate it for the great job and career that it is. Thank you.